Welcome to The Explainer. Today we're jumping right into something incredibly important, a stroke. We're going to walk through what it is, how you can spot it, and what the journey looks like from that initial crisis all the way to recovery. And this is all based on official medical guidelines. Let's kick things off with a number, 2 per 1,000. Now, that's the annual rate of strokes in the general population. It might not sound like a huge number, but think about it. It shows just how often this sudden life-changing event happens in our communities, year after year. Okay, so let's get right into it. A stroke is often called a brain attack, which is a pretty intense name, and for good reason. But what is actually going on inside the brain when a stroke hits? Well, the term beroerte is just the Dutch word for stroke, and it's basically an umbrella term for any sudden event that cuts off the blood supply to a part of the brain. When that happens, brain cells are starved of oxygen, and you know what? They start to die within minutes. It is a true medical emergency, no question. A really simple way to picture this is to think of the brain's blood vessels as a super complex highway system. A stroke is caused by one of two major problems. Either you get a traffic jam, where a clot completely blocks the flow of traffic, or you get a leaky pipe, where a blood vessel actually bursts and spills blood out where it shouldn't be. And if we look at the breakdown, you can see that the vast majority, we're talking 80%, are the traffic jam kind, or what doctors call an ischemic stroke. The other 20% are the leaky pipe kind, a hemorrhagic stroke. And this is a really big deal because the way you treat them is completely different. That's why getting a diagnosis and getting it fast is just so vital. So while the doctors need to figure out the type of stroke, what everyone needs to know are the signs. Seriously, recognizing a stroke quickly can be the difference between life and death, or between a full recovery and a lifelong disability. This right here is maybe the most important thing we'll cover today. Okay, so picture this. You're in a high-stress moment, things are confusing. How can you reliably tell if you or someone near you is having a stroke? Well, thankfully, there's a really simple, memorable test that absolutely anyone can use. And here it is. It's called the FAST test. It stands for face, arm, speech, and time. The first three are super simple checks you can do. If you notice any of these signs, a drooping face, a weak arm, or some weird slurred speech, then T is your command. It is time to call for help right away. Now look, the FAST test is a fantastic tool. It's accurate about 85% of the time, but it's not foolproof. Sometimes it can miss strokes that happen in the back of the brain. So the bottom line is this: trust your gut. If your instinct is screaming that something is seriously wrong and it could be a stroke, even if the test isn't crystal clear, you act. You always get emergency medical help. All right, so why all this emphasis on time in the FAST test? Why is it such a race? Well, because when we're talking about the brain, time literally equals brain tissue. And this chart, wow, this really paints a stark picture of why speed is so critical. A brain bleed is more than 3 times as deadly in that first month compared to a stroke from a blockage. Getting to a hospital for a scan to find out which one it is, it's completely non-negotiable. And this timeline shows you exactly what that race is for. For the traffic jam strokes, there are these powerful clot-busting drugs, but they generally only work if given within the first 4.5 hours. Other cool procedures to physically pull the clot out have a slightly bigger window, but even then, that door for effective treatment slams shut really fast. Every single minute of delay means more brain cells are lost, forever. Okay, so once that immediate, life-threatening crisis is managed, the story isn't over. Not at all. A whole new chapter begins, the road to recovery. And let me tell you, it's a journey that is completely different for every single survivor. And yeah, the type of stroke continues to make a big difference down the road. You can see that 6 months after a blockage-type stroke, almost half of the survivors are able to function independently again. But for those who survived a brain bleed, it's a tougher road. Only about a third get back to that point. That initial damage can really cast a long shadow. And recovery is so much more than just learning to walk again. Sure, there's the visible physical stuff, like weakness on one side of the body, but then there are all these invisible battles, this crushing fatigue that's hard to explain, depression, and major cognitive struggles with things like memory or just staying focused. But the good news is, nobody has to walk this road alone. A whole dedicated team of specialists works with survivors to navigate all these challenges. You've got physical and occupational therapists helping restore movement, speech therapists working on communication, and neuropsychologists helping patients and families cope with all the tough emotional and cognitive changes. It's really all about adapting to a new normal, together. All right, this brings us to the final and, honestly, the most empowering part of this whole journey, prevention. Because the goal isn't just to survive a stroke, it's to stop the next one, or even the first one, from ever happening in the first place. And if you need a little motivation, just look at this number, 15%. That's about the risk of having another major vascular event, like another stroke or a heart attack, within just 1 year if you've had a stroke or a mini stroke and do nothing to prevent it. That is a huge risk, one you absolutely want to get under control. So how do you fight back? Well, your first line of defense is your lifestyle. And these aren't just, nice suggestions. These are powerful medical interventions. Stopping smoking, getting regular exercise, maintaining a healthy weight, eating a good diet, and managing stress, these are the absolute cornerstones of building your defense. And the second line of defense is medication. For many survivors, this becomes a lifelong commitment, working hand in hand with those lifestyle changes. We're talking about antiplatelet drugs like aspirin to help prevent clots, antihypertensives to control high blood pressure, which is the #1 risk factor, by the way, and statins to manage cholesterol. Together, they build a strong shield against a future stroke. So what's the big takeaway here? It's that awareness is your greatest tool. Knowing the fast signs can literally save someone else's life, but knowing how to prevent a stroke, that can save your own. It's not about some giant scary overhaul. It's about the small daily habits. So the question I'll leave you with is this: what is the one small change you can make today?